Welcome back. It's Dr. Jen Ferboni, better known as DocJenFit, your doctor of physical therapy. And I want to go over Morton's Neuroma, especially if you're having pain right now in the ball of the foot. So that area, what can we do to take pressure off of that area? I'm going to go through some exercises. Now, if you want to know a little bit more about Morton's Neuroma, what is it? Why does it happen? What other exercises can you do to help the foot? I highly recommend checking out our podcast. So we actually have a video episode that we did all about Morton's Neuroma to go over the studies, the research, and what you really need to be paying attention if you've been diagnosed with Morton's Neuroma. Now, first, if we are having pain and tension right in here, what can we do to start to create some space? And one of the best and easiest ways is to take some socks. And all you're going to do is you're going to interlace them between the toes. So you want to make sure that the toes stay pretty nice and spaced out. So I wouldn't use very thick socks. As you can see, I'm using like the no-show socks. So they're really small and little, and they're not going to squeeze my toes too much, but they are going to allow for some increased space. And what you can do is just hang out. So you can do this anywhere from 5 to 15 minutes a day, at least. And then some people can tolerate a little bit longer. If you've never done this, you might want to start off a little bit on the lower end. So maybe 5 to 10 minutes at first, making sure that it's not increasing any sensation here if it's new. And then you can start to work up into wearing it more often throughout the day. My husband and I love doing this, especially at the end of the day. We just take off our socks, interlace it between our toes. However, another thing that we really love are these toe splays. So this is from Neboso, a company we really admire, we love. And what they have are these really cool toe splay, which I've never seen before. There's actually some texture to it, and the texture is for some extra feedback into our system as we're getting that stretch. So what you'll do is just kind of wrap your toes along, and it's jelly, it's comfortable, there's enough like room so that it can stretch for any type of feet. My husband, trust me, has much bigger feet than I do, being that he's 6'3". So if it's my foot comfortably, if it's his foot comfortably, they're so amazing and nice. And these, I feel like I can really get up throughout the day and I can move around, especially around my house, and just walk around wearing these, without putting too much pressure, tension, without opening my toes too much. And it really it feels so great. So I would recommend these. We have a discount code available as well. And you get 15% off. So we'll drop that into the description. You get 15% off anything site-wide. Now, after you kick off some socks or the toe splay, I just want to make sure that you just open your toes. Try your best. They might not look like mine right now, but just try your best after you've worn them. At least do it 5 to 10 times just to see, okay, now that I worked it passively, do I have this range of motion to maintain into my brain connection actively? It might not happen right away, but if you start to open up, you're going to start to increase that mobility and reduce that pressure around the foot. Now, another place that I like to make sure that you're reducing the pressure and tension is from the ankle. Okay. A stiff ankle is going to create some extra pressure right into the middle of your foot. So we want to increase this ankle mobility, but at the same time, in order to have good ankle mobility, so in order for my knee to be able to move over my foot needs to flatten a little bit. So I need to have the ability to pronate and flatten into my middle of my foot as well. And a good way that I like to kind of help with that is actually taking a towel right at the ball of my foot here. And I'm going to just take my knee and come forward. So this is going to help to stretch the bottom of my foot. At the same time, I'm getting some stretch into my ankle. So however you need to be to kind of lean over that body and stretch into this new range of motion and your ankle. I'll show both sides. So again, ball of your foot is up, elevated onto a towel. You're leaning that knee straight forward over those toes, trying not to let the bottom kind of kick out to the side, but just remaining over. If you need, sometimes it's easier to go onto a chair or a bench or an elevated surface if you really have limited ankle range of motion, or it hurts to sit back on your toes, which is the next place that we're going. So going onto an elevated surface might be a little bit more friendly to you rather than being low on the ground. The last thing that we can work on opening up is our big toe range of motion. Now, a lot of times it's super uncomfortable for someone, especially if they're in pain, to sit on their big toe. So a modification that you can use, which is also great for working that foot into the opposite way from pronation to supination, is what we do in walking. So ideally in walking, so you'll have one foot back here. You want your toes to feel like they're going to face forward. Again, if you can kick off your shoes, that's better. And when we're walking, we want to push off of that big toe and get that ankle all the way up as much. This is obviously an exaggerated place that we'd be for walking, but that's essentially where we want to work into. So what you're going to do is bring your ankle up as much as you feel comfortable and start to lean back into that big toe range of motion. You might be a little lower. You might need to back off a little bit. Maybe your feet need to come in a little bit closer. You need some more support from that front leg. That's totally fine. And you go and you find wherever your range of motion is. The goal here again is to have a little bit more of a step and draw that heel up as much as possible as we're stretching the bottom of that foot, that plantar fascia, and that big toe as we come up, which is where we need to go as we're going through gait. Okay. So starting to increase that range of motion into that big toe is going to be a really good place to be. Start with 30 seconds, work up to about a minute, just breathing and going into a new range of motion in that foot. But again, listen to your body. We don't want to increase any pain. So make sure it's a place you feel comfortable starting, and then you can always progress from there. And if you want to assess where your biggest restrictions are, what you might need within your foot, we have a barefoot mini course that goes over 2 weeks of assessment and exercise, educational resources, webinars with a podiatrist. It is a great resource to start to understand what your individual foot needs. So I would highly recommend checking out the barefoot mini course if you experience some foot or ankle pain. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.